everyone, it's Charla again. Welcome to my Ed Talk. Today we're going to talk about opioid-induced hyperalgesia, or OIH. What is OIH? Well, normally, when you give an opioid, the patient's pain decreases. But with opioid-induced hyperalgesia, you'll have a rare paradoxical response to an opioid, where instead of decreasing your pain, your nociceptors become hypersensitive to the pain. Here is a normal nociceptor response to pain. So normally, when a painful stimulus occurs, your nociceptors get activated. And when you give an opioid, it normally helps to decrease that pain. But with opioid-induced hyperalgesia, when you give an opioid, your nociceptor actually becomes hypersensitive to the same pain. And instead of your pain decreasing, your nociceptor gets really, really mad, and your pain actually can increase. Well, who does this happen to? Well, it can happen to both opioid users that are chronic users, or chronic opioid users, or it could happen to opioid-naive users. What is the mechanism of action? We just don't know. There's a lot of theories, but we are still uncertain. But we do know that opioids induce this kind of reaction. What are the signs and symptoms? Well, you'll have an increase in pain when you give the opioid. So your pain just gets elevated for the patient. Or the pain can actually spread to other sites other than the original site of pain. And normally, if you find that you're giving 3 or more doses of this pain medication and the pain is not decreasing, then your patient is not feeling A-OK. Your patient is having OIH. Again, when 3 or more doses of opioid is being given, your patient is not A-OK. He's OIH. Interventions. What can we do for these things? Well, if you have an opioid infusing like fentanyl, you want to stop it. Then you can give Tylenol IV or PO. And you can give NSAIDs like ibuprofen and naproxen. And you can even give Toradol or ketorolac IV. Gabapentin and Tegretol have also been shown to be quite effective in helping with OIH, as well as antidepressants like SSRIs and tricyclic antidepressants. You can also have local or regional anesthesia depending on the surgical site. Thank you guys for watching.